Good morning. This is Steve Stites, Chief Medical Officer at the University of Kansas Health System. We're broadcasting live from the Dolph Simons Family Studio here in Kansas City, Kansas. We are delighted to be back with you this morning as we tell you the truth and the honesty of all things COVID.
That's right.
Back in the studio with my good friend Dana Hawkinson. Of course, we all know him as Hawkeye now, or Doc Hawk. What's going on out there today?
You know, we're about the same amount of patients as we've had the last week or so. We are at 34 patients in the hospital. We have 9 of those in the ICU and 5 of those on the ventilator. So we're holding steady right now, which is better than going up to the 40s and 50s.
Yes.
We did have an ICU call with a bunch of ICU directors around the city. Again, this is really brought about by Louis Satterwhite and Dr. Castro as well. So there are a lot of ICUs that are running heavy in capacity right now, so this is nothing new. All over the city, and if you talked about this before,
yep.
There are just more and more COVID patients in the hospital compared to where we were in April and May.
You know, it is. Had a chief medical officer call yesterday with really most of the major hospitals in Kansas City, and it was interesting that some people clearly had a higher census than they've ever had, and some health systems are pretty high. What I will say is that last week, I call it the core 6. Those are the hospitals that have always been on with us, the CMOs that have always been on with us since the very beginning of the crisis. And we've been able to track the census for those 6 hospitals, and they're major folks, right? It's St. Luke's, it's KU, it's Shawnee Mission, it's Liberty, it's North Kansas City and Olathe, and our St. Francis campus. So very cooperative conversation, and periodically HCA joins, which is great. But what I know from those, what I call the core 6 hospitals, we peaked at 200 patients about 2 weeks ago, or about a week and a half ago, I'm sorry. It went down a little. Okay. It's running in around 190, 195, so essentially the same. It hasn't really gone above that yet. So I think that's good information, good news, and this ICU census is staying quasi-stable. The difference is we're all, and I said to all the CMOs, do you have capacity if we need to add more patients? And the answer was yes. We could get more ICU beds. What we've got to hope is that continuing increase in the number of positive patients we're seeing every day that's above testing. Like testing numbers have kind of gone up, but there's an increase in the number of positives beyond the increase in just testing. And so what we have to hope is that that's not translating into more critical illness down the road, because that's going to be the struggle, and we'll see how that goes.
Yeah, exactly.
So we've got some very interesting guests today because we have a good approach, I think. Dr. Heather Harris, who's the medical director at the HaysMed Campus for KU, is on by phone, and Dr. Jennifer Jackson, who is one of the physicians down in internal medicine in Wichita, Kansas, is going to join us about what's going on in Sedgewick County, where they remain they are a hot spot, kind of like Wyandotte and Johnson County for COVID-19. And we know that the positive cases in Kansas grew by more than 1,000 over the weekend, and 64% of that was in Sedgewick County. So we'll be curious to talk with both of these good folks. And then Anil, okay, now, Anil, you're going to have to make sure I get this right. Anil Gharmalker. How's that close?
You just got it spot on.
Awesome. Anil is back with us today. If you'll remember, Anil had COVID-19, was here in the hospital, was here with us. He was here in the studio a few weeks ago with us. He's back in the hospital. Again, for all of you out there who question, maybe COVID doesn't exist, let's ask Anil if it exists. I think you're going to hear a yes. Anil, how are you doing? Tell us a little bit about what brought you back into the hospital.
Well, actually, I was in Wichita, and my airway started closing again. And they recommended I transfer back to KU Med. And we had to do a tracheectomy, I think, an awake trach or whatever they called it. And Dr. Kraft out here was amazing. After a week in ICU, they were able to bypass all the breathing issues and put a trach tube in, and I guess I got a speaking valve now, so I can actually get heard. And I guess we're just working back now, trying to work on fixing it from this point forward.
Luck with that. And how do you feel? I mean, the breathing issues are hard, of course. How do you feel otherwise from the COVID-19?
Actually, I feel great. I mean, you said the same thing last time I was there. Was as soon as we solved the breathing issue, I'd be off to the races. I mean, there's a little bit of stamina still to gain, but I mean, just the day I woke up was amazing. I didn't realize how much I wasn't breathing till I wasn't.
Struggling to breathe. So, Anil, talk to our audience. We know there are still people out there who think that COVID isn't real. There was a group of physicians who were on the Capitol steps. I'm still not sure where they came from. I call it a fool's folly. They were up on the Capitol steps in D.C., and I think it was sponsored by Breitbart News to tell the country that really COVID isn't real and that it's fake. Talk to us a little bit. Doesn't look like it was fake to you.
Oh. Yeah, I definitely had a different impression. I think I watched that same video. I had some people I knew and have known like my whole life that got wrapped up in that video, and it just seemed more political than scientific. I mean, I've never, I hate when people deal in absolutes, and a lot of their quotes were like, I had 350 patients and not one of them got hurt or not one of them got sick. And I mean, even the best medicine isn't 100%. It seems absolutely ridiculous. And it scares me that someone, the truth, I guess, might be more frightening and it might be easier to grab onto something. But, if you grab onto something like that and avoid real medical care, it may be too late by the time you look for help that could help you. And, that would scare the dickens out of me that someone could, just to feel more comfortable, could put their life in jeopardy.
And I think
just
that
to
was
make a political statement.
Yeah, that was beautifully said, and I can't find the words that you just did. Those were great words and great advice. And pandemics are hard. Politicizing a pandemic, well, you see, that's just stupid, because we have to deal with the hard instead of dealing with the stupid. So let's just stick to the hard part. Let's try and make people better and try and prevent people from getting sicker. Yeah. Heather, how are things out in Hays?
Good morning. Yeah, we're definitely seeing an uptick since the last time I've been on the show out here in western Kansas. One number I'd love to share, just showing kind of how the holidays and people moving around and gathering has changed. On June 29th, so exactly a month ago today, we had 21 cases in Ellis County. We had 111 cases approximately in our service area, which encompasses about 23 counties out here in western and northwest Kansas. As of today, or Monday's counts, let's say, so a month ago, or now a month, we have 115 cases in Ellis. So, and everyone can tell that's more than a double. And we have almost just short of 275 in the county, and certainly climbing every day. We're having positive cases every day. Last week, more in the single digits. This week, we're having them in the double digits of every day. Unfortunately, on the cusp of opening schools, hopefully within the month, which brings some challenges. And then we also, since that 4th of July mark or right before that, we've had someone in the hospital every day for COVID. Typically, our average census is running between 4 and 5. But prior to that, we had gone weeks with no one in the hospital with COVID. So certainly, we're seeing the changes as well. Certainly not the volume that you are in the city, but for the percentage of folks that live here, certainly something that we're still working with every day.
Yeah, and we know it's going everywhere. I think that day where we thought western Kansas was going to get spared is not true if you don't follow the right infection control principles. Jennifer, how are things in Wichita?
Hi, good morning. Well, I was surprised to hear the Kansas City numbers. We are a little bit higher than you guys. Here in the Wichita area, we have 2 hospitals that receive most of the COVID patients, and that's Wesley Medical Center and Ascension Via Christi St. Francis. The number at Wesley yesterday was 28. Here at Via Christi today, we have about 40 inpatients, and 16 of those are in our COVID ICU.
Busy. How are people doing with masks and taking the good infection control principles we do know that work?
Well, certainly in the hospital, everybody is very serious about that. Even in our workspaces, we have on our masks. There's patrols at all the entrances to screen people that are entering the hospital. And of course, we're on lockdown in terms of visitors. So I'm just talking about the workers that are here in the facilities. And we have masks available if you don't have one. And that's been going on for quite a while. Our county has been a little bit more laxed until recently. Most of the rules were voluntary and depended on the goodwill of citizens to follow the advice of the healthcare workers. That has changed. The county commission has pretty much given control to Dean Mins, who is the healthcare czar for our county, and he has put in orders. Most recently, they closed the bars in Sedgewick County to try to decrease people gathering together where they were concerned that spreads may be happening. And so that just went into effect July 24th. And so we're hoping to see some effects there. I do think in the county too, people are taking it more seriously now. We've been seeing our caseload up for quite some time. And everyone's concerned about the effects of the health of the people and of course the economy. I think everyone wants to see the kids going back to school soon. Most of the schools in the area have delayed their school start date as well in response to the higher numbers.
Yeah, it's tough, and I think, and I'm sure you know that really it's all about those principles of infection control that we hear Hawkeye preach every day. Thoughts about how that's being received in Sedgewick County now?
Yes, I think that more people are coming to the realization that we're going to have to take those simple measures. I do, however, think that there's an opportunity to talk about more than just social distancing, hand washing, and staying home when you're sick. I think that what COVID has done for us is it has quickly uncovered some of the glaring healthcare disparities that we have. And what we're being shown by this virus is that people that are metabolically unhealthy are much more likely to do poorly with this virus. And so when we talk about the metabolic health of the United States, we know that very few people don't have a chronic disease such as hypertension or diabetes, obesity, or cardiovascular disease. And so that really shines a light on our healthcare food systems. I think that we need to start having those conversations. If people are looking to try to decrease their risk, we know from data that you can change your metabolic health pretty quickly by lifestyle choices. And I think that that conversation is starting to take place. Our own Dan Glickman published an article with CNN recently about can we change the course of this virus by the food choices that we make? I would like to see that as the next conversation.
Yeah, I think that would be an interesting conversation for folks to have, especially making wise choices, because it makes a difference for so many issues in our health, Dana, and it's not limited to COVID-19.
Absolutely, and we've said this before. It's never too late to do the right thing. You can make those changes. You just have to decide to do that. And I think this pandemic, these situations really can help somebody move along to make those choices. Dr. Gerald Mins was on the call with us today, so I think Sedgewick County is in good hands. He is a pure Kansan. He has the health of the public at the forefront of what he's doing, and so if the county can get behind him and do what is recommended, they will do better. But there are a lot of cases down there now. It is a hot spot.
Yeah, Gerald is a great man. Well, let's see, Jill, if there are questions from media this morning that we can try to answer.
All right, KCTV5. Yeah, well,
there we go.
They're starting to send them to me. Yeah.
All right. So you're 5, 4, 9, and 41. Is that what you're telling me?
Yeah, that's right. That's what I'm saying. Okay. What is the responsible thing for a parent to do if they test positive? Do they need to remove the kids from school and notify the school immediately, or is there wiggle room?
So this is if the parent tests positive. Should the kids stay home, Dana? What do you think?
That's a good question. I think when we move further into this and seeing exactly what is the infection dynamics, what is the climate like when school starts, we have to decide to, how to navigate these things. Because the same question can be said, well, what if a child is sick in the school? What is the extent of that contact tracing? Is everybody around that child out for 14 days? Is the teacher out for 14 days? So I think all of these questions have to be answered. I don't know that we have the answers to those questions yet. Certainly at this point, the quarantine is going to be important. Trying to isolate and physically distance in the household, wearing masks in the household is going to be important. I don't know that we know the answers to those questions, but if that does happen, really continue to have in-person classes if this continues on like it is, that will be unsustainable because so many people will be out for 2 weeks, 3 weeks, 4 weeks of a month, and then you have nobody in class, things of that nature. And so I don't know that we know the answers to those yet. But
I do think you reflect back on it, it's really the same question we should ask about any workplace. If one person in a household, be you married or not married, but if let's say you're sharing an apartment, whatever, if one person's sick, can the other person go to work, right? Can the other person go to school? And it's probably different if you're less than 9 years old, because that you may feel a little more comfortable with. Over that, I think you just have to decide what's our level of contact been like, and if it's been really close, I don't know. That's a hard one to be going back to school in this case and potentially being around a lot of other kids and the teachers. I'm not too nervous about the parent gets sick. The kid may have to stay home. Does that mean the teacher should stay out? That's that second-degree exposure.
Right.
If we start chasing second- and third-degree exposures, we'll never have anybody go out anywhere. And so I don't think we can do that. But I think we can say that first-degree exposure you have to take a hard look at. I think that'd be the right thing to do. And that's kind of what we would tell other folks in that setting.
The follow-up question that Betsy has to that is, what do you do about notifying other parents?
Yeah.
Should the school be letting everybody know, and then does that do a cascade of folks staying home? What's the advice?
Yeah, I think we have to do the same rules of infectious control wherever we go. We follow them, and that's contact tracing. So I think we follow through with contact tracing. Dana, what are your thoughts?
Yeah, contact tracing, and again, you're dealing with a school, not a healthcare system, but it's still some privileged health information. So, notifying parents, it may just be we're notifying you because there has been exposure to your child. That's the only details you need to give. Continue to be on the lookout for symptoms, things of that nature. And then, once we get into the school and what is the protocol for somebody that has been exposed at school, you'll know more about what to do. But I think, notification is probably going to be happening at schools or daycares or anything of that nature.
Jennifer, what is Sedgewick County? Are there county guidelines that you know of around this question?
Around the schools. Right now, the schools are meeting to make decisions about those processes. But the county commissioners for most of our area have left those decisions up to the local school boards and administration to make the decisions.
Some appeal to that when you know that different counties have different levels of disease. The only problem is that it leads to a lot of inconsistencies from one county to the next. And so I don't know what the right balance with that is. That's a hard one. But I do think there are some things we should probably establish that are going to be true for everybody. And to me, it feels like this sort of, I call this contact tracing, really ought to be pretty similar across the state.
Final question from KCTV5 is, do you have any concerns about the effectiveness of nasal swab tests that are self-administered?
Okay, self-administered nasal swabs. I don't know about that one, Dana.
I
think when the saliva test comes out, and I think it's actually, I know it's here, you can start doing that. I think that one I feel pretty comfortable with, self-administration. Nasal swabs, I don't know, man. You're going to have to induce a lot of pain to yourself.
Yeah, absolutely. We have talked about that. It's called operator error. We know our operators, the people who are doing the test on you, are very well trained, are very well experienced now. So we were pretty assured that they are going to get an accurate sample. Giving this to somebody who has never done that before, for anybody, I mean, even myself, you're probably going to have a larger amount of operator error, the inability to obtain an adequate sample than to get an adequate result. So obviously, and absolutely, there's that concern there.
Yeah, I think that's right. I think I would wait for salival testing to be more widespread. It's in a couple of labs now. Quest has gotten their approval. CRL has approval for watching it to be medically administered. They're in front of the FDA right now with they had to answer a few more questions around letting people do home administration. But I think that's going to be a lot more successful. That's going to work.
All right, that's all for KCTV5. Moving on to community questions. Kay wants to know what Dr. Heather Harris thinks about the Rush County Fair opening tonight.
Oh boy, Heather,
good.
Fairs, county fairs. I know what I'm going to say. What are you going to say?
Well, it all depends on how they're going to post it. You know, the big things are big crowds continue to be certainly out here in Western Kansas, a link to many of the positive cases and clusters that we've had. We had the Ellis County Fair, and they did some change up for some of the activities to, you know, be a little more less contact as much as they could. But people need to make sure they can, you know, have social distancing, be very careful of high contact surfaces. I don't know if there's a carnival. I'm not exactly sure what all the activities have planned, but you know, there's a lot of risk involved in a lot of that high contact surface areas. If there's a carnival, if it's just going to watch the rodeo and you can stay 6 feet apart, and if you can't wear a mask, you know, I think some of those activities can be safer, but certainly if you're in a high risk population, any group gatherings are certainly, you know, high risk. We see it over and over again. People gathering continue to be an issue. So, needs to be done safely, and you need to identify yourself as someone, you know, if it's someone you should be there or not. Kind of is my, you know, at least initial opinion as these things begin to roll out. What are your thoughts, gentlemen?
Yeah, I'm not in favor of fairs right now. You know, but I'm going to come at it purely from a healthcare perspective, not a political, social perspective on this, and that you know, that's clearly my viewpoint is clearly slanted by that. And I think it is that fairs, as much as we want life to be normal, represent an enormous source of risk. And why would we entertain risk when we want to just keep people alive and make sure that next summer vaccination is going to be out there? I think that's going to be super successful, and we'll be back at it. And don't we really want all our loved ones to have the opportunity to go back to a fair when there's not a risk? So I just don't see it, Dana.
Again, it goes back to risk versus reward. We have always argued to not be in large group settings. This is a large group setting. It is outdoors, so that is good for the most part. You know, if you're in the rodeo or the livestock show, you know, but can you maintain that distancing? That is going to be the very important part. And can everybody be wearing masks? Because I think in that situation with the large groupings, at least in the demonstrations, many of those people were wearing masks. So I think that was a very helpful thing. I would certainly encourage mask use. You know, I don't know if you can make it mandatory that you wear a mask into the fair and when you're watching the rodeo. I think that would be best for everybody. But there is a risk versus reward there. It is definitely high risk just because of the amount of people. And if you consider that 1 or 2 or 3 people have that and they're with you, around you, watching the rodeo or doing whatever, that ability to spread that virus is going to be so high that you could see clusters and outbreaks in those cases. So definitely, if it has to go on, I would definitely encourage a mandatory masking, even though you're outdoors, because you are around so many people.
Yeah, I would agree. Anil, remind us how you came in contact with a virus. And you told that story last time. Help our listening audience understand. They may not all know that. Help us understand a little bit about how did COVID come to you?
Actually, I got it while I was delivering a load in Indiana, so I'm not sure who or what I came in contact with to get it. But it came on, you know, it started with a kind of like allergies or pneumonia and just rapidly progressed and kind of took me down in the area. And I think before I knew it, I was on a ventilator in a helicopter and on my way back up to Kansas City.
I remember you were driving back to Kansas, and you were getting sicker as you drove.
Yeah, I did. I just felt, you know, the fatigue came on and the lack of oxygen, and it just, you know, it was really just everything I could to keep moving. You know, I was maybe able to stay mobile for a couple hours at a time, you know, without having to take a nap or a break. And, you know, not to sound like Gilligan's Island, but it turned a, you know, what would be a one-day trip into 2.5 days to get home. And I mean, it definitely just took me out really quick.
And then you were here and how long were you in the hospital the first time?
Oh, sorry. The first time I was at the first hospital for about 4 or 5 days, and then I was at KU Med for about a week on the ventilator, and then it was almost a week of recovery, and then we came back for another 5 or 6 days, about 2 weeks after we got out, and then from then on we've been in and out of emergency rooms and hospitals until we came back about a week and a half ago when we checked in on last Monday at ICU up here in Kansas.
And Anil, so I'm doing the math on that.
And
that's
we get to
34
go
days.
home
You get to go home today?
Yes, we are going home today.
That's awesome. Well, congratulations. We're delighted to hear that. So when did you first, what was the day you first got sick? Yeah. What day did you first get sick?
I believe it was April. It's somewhere mid-April, around April 18th or April 20th. Or the first hospital admission was April 21st, I believe.
I was doing the math in my head as you spoke. Yeah, sorry. You've been sick for about 3.5 months, of which 35 of those days are spent in the hospital. Mm-hmm. I think that makes COVID very real. Well, good luck going home today.
Definitely didn't do a very good job of being a hoax.
Well, and
no, it's a bad hoax.
I think when he was, I thought he had said he got it while he was in Louisiana picking up it. But then one of the most striking things he said is that when he was driving back, the only way he could breathe easy was taking shallow breaths through his nose, which I've tried that. That's not easy to do.
No.
So he was suffering a lot. Hopefully he's breathing much better than he was when he first got his symptoms.
Yeah, it's sort of an auto PEEP. That's a medical term. But you're kind of doing a little way of doing some positive pressure breathing like that, and you keep your mouth closed, breathe through your nose, and just try and grunt. And it's hard to do, and it will wear you out really fast. So, okay, well, Jill, bet there's some more questions out there.
Oh my gosh, they're really flooding in. I really applaud the community for asking great questions. But Jordan from Channel 41 has one that we're going to ask real quick. She says that local restaurants are having to spend thousands of dollars to get their employees tested when someone gets sick.
Yeah.
Can you talk about the testing availability, the speed, the cost, and advice to these business owners?
Yeah.
Okay, well, let's talk about here, and then we're going to ask Dr. Jackson to tell us a little bit about Wichita. So, Dana, what do you think is going to happen here in Kansas City? Because it is expensive and it is frequent.
Yeah. You know, when there's an exposure, we have never been one to advocate for testing, because that testing is only good for that day. We know that the incubation period is 14 days, so that's why the quarantine is 14 days. So any time within that 14 days, you can develop symptoms. You may not ever develop symptoms. We know that there are people that are asymptomatic, but we know that the majority of people who develop symptoms are going to develop them within 5 to 7 days. So, you know, the testing is done after exposure. I'm not sure what the time frame is, probably different businesses. You know, moving forward, that is why we've always advocated for all employees to be wearing masks, to continue to try and social distance and physically distance as you can in whatever place of the business that is. Obviously, in some places, it's easier than others. So certainly testing, we do want more testing capacity. We want quicker results. Those are not brought to market yet. Hopefully in the near future, those types of things will be. But right now, we are kind of stuck on what we have. The testing capacity is really somewhat maxed out as far as the ability of places to do the testing, but also the places and the kits and the materials that we're able to get from the companies to do the testing as well. So obviously it's not ideal. Moving forward, hopefully there will be some other inexpensive and efficient ways to get that testing done.
Yeah, and I think what I would look toward in the future is more of the pooling strategies. Again, if the salival testing continues to progress, I think within the next few weeks that will become a very, very viable option. It'll be less expensive. It still is expensive, but one of the questions that you just said, or one of the points you made, Dane, is, do you really need to do testing to go back to work?
Right.
So do we do that here in the hospital? Do we make employees test before they come back to work?
We do not test before you come back to work.
And to help our audience understand why that is, because a lot of businesses want you to test, but here at the hospital, we're not requiring, and most hospitals don't require it.
So certainly the easiest answer to that is if you have been diagnosed with COVID-19, and even the CDC now really does not recommend repeat testing if you've already been diagnosed with a positive PCR test. Unless in its special circumstances and discussion with your physician. And that is because we know that you can have a positive test for 60 or 90 days. Yeah. Despite, for the most part, if you have mild to moderate disease and hospitalized, or if you're not hospitalized, the main course of thinking right now is that you probably are less infectious at 8 to 10 days out from your initial symptoms. You're definitely most infectious 1 to 2 days prior to symptoms and 1 to 2 days after symptoms start. But again, that is why we have advocated so much for the mask, because if it is prior to symptoms, you have that barrier to protect other people from you. As far as other testing, we don't otherwise test even for exposed employees. We don't test to come back to work either. Again, for that simple fact of that PCR test is only good for really that day and that point in time. And after that, it could become positive 12 hours, 24 hours later, and you still wouldn't know it. So.
Yeah, and I think that the key is that after about 10 days, or you don't spread the disease anymore.
Right.
And so at that point, you can probably go back to work. And if you've been exposed, it's 14 days, because that way it gives you the 4 days to become symptomatic, and then 10 days later you should be not spreading the disease anymore. So it's 14 days. So I think one of the questions we have to ask ourselves is repeat testing to make sure that you're, quote, negative. Is that really meaningful? We don't do it. Yeah. CDC says you don't do it. But what we do say is you can't be at our hospital if you don't have a mask on as an employee. Yeah. And if you can't wear a mask, then we can maybe find something for you to do that's way off campus or stay at home. But other than that, you can't work here without a mask. And that's why we do that. It helps us to stay safe. Dr. Jackson, how are things going? What do you guys? How do you approach that down in Wichita?
Oh yeah, I agree with everything. I echo everything you've said. Wichita's had a lot of experience with no tests. Even in the beginning, when other people seemed to be getting tests, we were really struggling. And so most of our protocols were built around really no testing information. And, you know, the tests aren't awesome anyways. So I think that following the CDC has updated their recommendations just recently, and following those guidelines can really help the community in terms of essential workers coming back to work with less expense.
Yeah, I think that we're gonna have to continue to have that conversation as a society to help us get to that point. That is probably a reasonable point. And even as we look at reopening the KU campus, we're doing a lot of testing up front, but then it's really about 10 days, 14 days, and we're not doing repeat testing. So I think that's, if we can keep KU safe like that, and I've got my fingers crossed on that one, we can keep society safe. Yeah. It's all about the mask.
Yeah, and, thinking about this when I'm just doing other things at home and whatnot, I would almost be one, and this, is just my own opinion, as you think about the disease process, the number of asymptomatics, the duration which most people probably shed live viral infectious virions while they are sick, almost looking at reducing that amount of quarantine time from 14 days to 12 days as well.
Yeah, it may happen.
So, but those are things that we need to look at moving forward. That's not it. The quarantine is 14 days because you can still exhibit symptoms, but I think as we get further into this, less and less. If you are going to have symptoms, the majority of people are going to have them. Even at 12 days, 98+% of the people who will have symptoms will have symptoms.
So Hawk, do you think there might be a video out there demonstrating the effectiveness of masks?
I think there is. I've heard that there's one. There's a local video.
I think there is.
The effectiveness.
Didn't they use like a freezer or something like that?
Yes.
Yeah. Somebody ought to look that up. It's pretty good.
And adequately showed barrier protection.
Yeah, it's a great demo.
Yes. Maybe we'll play that at the end of the broadcast.
Yeah.
Guys say they can. We will. We'll play that
Okay, well,
again
there you
in
go.
the
Such great
broadcast.
singing on it, too. Okay.
So Rachel lives in Sedgewick County, and she kind of echoes what I'm seeing a lot of questions on, and that is the perception of, she sees people mask wearing when there's strangers around, like going into a store. But she said friends and family seem to feel safer around their friends and family.
Yeah,
She wants
absolutely.
you to try to reconcile that. Is that true? What is the etiquette? What do we do? She's seen a lot of people not
Let's
wearing
take
masks.
that on. All right, Dr. Jackson, you're down in Sedgwick. Take that on, and then
Yeah.
Dan and I are going to go through our bubble talk after
Yep.
that. Because we like bubbles.
Yeah, that's really an interesting observation. I agree. In fact, I'll tell them myself, I spend so much time with our residents that I feel like they're my family. And I think I was a little bit laxed at wearing my mask when I was with them, when we were talking through patients in our workspace. And I was reminded that, you know what, that's probably not the best practice. And so I think that's a really good observation to think that, we want to keep each other as safe as possible. And so we need to be vigilant, even in those spaces around our loved ones.
Yeah.
Yeah, I think that's right. When it's all about I think it's the bubble and the security of your bubble. So, and Anil, I'm going to come to you with this question here in just a minute as well. So that's a fair warning. When my wife and I at home, we don't wear masks, but we don't wear masks to bed, so that makes sense. My daughter comes over with her partner, and it's like, okay, you guys, we're not going to have a mask on, but I know what they're doing.
Yeah.
I know that they work hard at staying safe. My son is the same way. Now, my daughter lives in Chicago. We're going to go meet she and her partner up in Wisconsin this weekend, and I've not met him before, so that'll be fun. But we're trying to think, okay, so are we going to wear a mask because they're coming from a different city and don't necessarily know him? So I think we're going to start out with masks so we get a pretty good sense of where things are, unless we're outside and we have physical distancing. Dana, what do you think? I do think it's this bubble concept.
It's all about the bubble. You are able to know your household for the most part what the bubble is, but as you break out of your household, you can't always be certain who is in the other household's bubble or who in the other people's bubble, and that's why you need to have frank conversations and be upfront with all about that. There's a patient in right now that I'm seeing who has been home. The spouse will go out to the grocery store sometimes, but other than that, their bubble is just them, from what I was told by the patient. But the patient's in here now with COVID-19, so it is out there. And if you can take those other precautions, distance while you can, even outdoors, indoors, even if it's family and friends, distance while you can. You can give a hug, things of that nature.
That are brief.
Brief, yeah, absolutely. Wear masks when you can. But you have to take all of those things into account and understand that the virus is out there. Even people who have really no other contact and have their own bubble are getting the disease as well. But those are things that you can do to take those steps and reduce the risk of transmission. And it does go back, as we've talked about, not only with the bubble talk, but the risk versus reward.
And I think you can it's like I have a work bubble with the nurse who I work with and respiratory therapists are all in one office together. And, and so when I'm there, we're making phone calls to patients, and we have this thing, we all know what we're doing, and so that's a work bubble. And I think those are some risk, benefit, reward things we just have to decide in life. Anil, how did your family handle this? When you were sick, what was the bubble like for everybody there?
Well, initially, we were definitely separating and isolating, but I think when the reality that it was COVID, we definitely tightened up our bubble. I mean, I know when we're out and about, my wife and kids, they're definitely masked up. When we're in public, we're definitely, we've limited a lot of social contact, and avoided those large groups and even small to medium-sized groups. And I know there's, we've been having talks now, because with the trach tube, it's an open pathway to my lungs. So we're really even talking about closing down our bubble, as you put it, even tightening up, I guess, security for us right now, because we'd like this episode to end better without any more infections. of any sort for a while at least.
Well, Jill, let's have one more question today. And so what's going on?
It's hard to pick a good question. Bailey wants to know, JCDHE, so is that Jackson County? Probably. Department of Health.
Yeah.
Just released gating criteria for schools and are saying that elementary can meet in person as long as community transmission is less than 15%. She wants to know if we ever had less than 15%.
Yeah, that's a great question, and I actually haven't seen those criteria yet, so I'm going to be I probably want to read them before I make too much comment on it.
And I'm not sure, I don't know if it's, Jackson County or Johnson County. I think we need to see the criteria, and we have to see what the, really the percent of positives or the community spread is, depending how they look at those numbers are, say 1 to 2 weeks prior to starting school.
So let's take that question on tomorrow when we've had a chance to look at the criteria, and we'll be able to.
So how about an easy softball one?
Okay.
Lindsay wants to know, do you need to call ahead to the ER if you think you have COVID, or do you just go?
Heather, what are you guys doing out in Hays with that? Are you asking people to call ahead?
Yeah, so what we're doing is if people are not acutely ill, we're asking them to wait until they call their primary care physician. If they're emergently sick, we are identifying them right at the door if they need to go to the emergency room. So that's they certainly call, but we're asking all those questions very quickly as soon as they get close to the emergency room so we can assist them quicker. Our whole goal is not to have folks that we're concerned about waiting in waiting rooms. And everyone's wearing masks here. We have a city ordinance now. So that's been our guidance, is to call first, and we're screening everyone in all clinics and emergency room and walk-in.
Makes sense.
Yeah.
Dana, I think that sounds like us.
Yep. We have all of our employees now wearing masks and eye protection. If you are ill and you are coming to the emergency department, wear a mask. That will help as well. But I don't know that necessarily initially we did have people calling ahead for coming to the emergency department. I'm not sure we're doing that anymore because we have universal masking and everybody is protected, employees and patients as well. So.
All right. So, Heather, final thoughts for our audience today.
Final thoughts out in western Kansas. I just, a few applauds that I will say out here. I do feel like a lot of folks are being really responsible, and as soon as they don't feel well, they're staying home. And I think that is one thing I continue to really encourage, is for folks to really recognize that they don't feel well and to stay home, and then, of course, get appropriate testing as needed. And so that has been helpful. I still am concerned about the high-risk population. We continue to see those folks get sick and be very sick. So, as you guys talked earlier about a bubble, we are one giant bubble out here in Ellis County, and unfortunately getting lots of holes in it. So I really encourage those folks caring for older family members that are chronically ill or just even elderly, just to be very cautious around them when visiting from other places. That we're seeing lots of, unfortunately, clusters related to that. And just for everyone to keep wearing masks and trying to be smart. I know it's hard, not to gather. I think the school, I'm excited for kids to get back to school. I really am. But as all of you are, just sort of anxious about what that means and what that will look like for the cases. Our college will be starting here as well in August, and all those will bring a whole nother set of dynamics that we've not seen since our eternal spring break started in March.
The eternal spring break, that's right. Didn't feel as much like a spring break, I don't think.
No.
Jennifer, how about final thoughts from Wichita?
Yeah, I think that COVID has given, shine the light on just amazing opportunities in medicine here in Sedgewick County, with people, the physicians coming together, getting involved in politics. Of course, Dean Mins is an excellent medical czar, and now that they've pretty much handed the reins over to him, we're hoping that in a couple of weeks our numbers we will see a downtick. Because we're all getting a little tired of the high number count here in the hospitals.
Indeed. So a couple points just to wrap up before Anil. I think you should have the you should have the final word today. Dr. Joseph McGurk, who is our director of the Hematologic Malignancies and Cellular Therapeutics, blah blah blah. That's a lot of words right there. And the medical director of the Blood and Bone Marrow Transplant Program joins us with Dr. Elizabeth Menks, a psychologist who's been with us on the program before, to show how cancer patients have learned to do things and to talk a little bit about how it's affecting their lives with wearing masks, social distancing, washing hands, etc., to stay safe. You're going to see a certain video in a minute to just talk about how masks really do work. There may be a return engagement in that freezer. I've heard that there's been some recruitment of that. People are asking for the vocal talents of those two fine folks to come back. But before we have to hurt the audience with our voices, Anil, final thoughts for us today.
I think as things are ramping up, just everyone be careful, be safe. I think you said it best last time. Just do the things that, we learned in kindergarten. Wash your hands and be courteous and respectful. And I just want to give a big shout out to everyone at KU. It's been a lot of fun this last 11 days, and everyone's been great here. And Dr. Kraft, we love you. Thank you. I love breathing again. And I guess that's as simple as I got it. Just stay safe and be smart.
God bless on your journey, and Godspeed for your recovery.
Yes.
And to all our audience, remember, there's still no place like home. Right. We're broadcasting live from a 0-degree freezer, where I wish I could tell you we're here for a cold beer, but instead what we're really doing is telling you what a breath cloud is like. And I'm here with my good friend, Hawkeye, and we're here to make a point, because if we start talking like this across from each other, wow, it goes out about 3 or 4 feet. How are you?
Doing good.
Where are our breath clouds going? It circulates up in my head. It goes high, it goes low, it goes everywhere. This is what happens when you're out in public and you're talking to each other and you're closer than 6 feet away. Let's try and do a little Royals here. How about if we do Let's Go Royals? Yeah. Let's go Royals! Ho, 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 ho! Go Chiefs! Oh, say, can you see? There are breath clouds go traveling to each other. But what happens if we put on a mask? Let's just see where our breath clouds go. Hey, Hawk, how's it going?
I'm doing good. It's cold in here.
It is cold in here, but I'm feeling better because your air is not coming to my space right now.
And I can't sense any or see any of your breath.
It's a lot better. Shall we do that Royals cheer again?
Let's do it.
1, 2, 3. Let's go, Royals! Go Chiefs! Oh, say, can you see? Right there. It doesn't go anywhere. You know what that means? It means we're keeping each other safe. You can do it too. Do it with your family. Do it for... Wear your mask. It really does make a difference.
Hi, my name is